Did you know you can identify a patient with something other than just their name and date of birth? And it's not their armband. If this surprises you, you might want to watch this video coming up next. Hello, Clinic Review families. Dr. Sharon with Clinic Reviews. Today I'm talking about patient identifiers, and it's from the Blue Book, which is, it's right there. It's pages 25 and 26. If you have the Blue Book app, which you can purchase at clinicreviews.com, the Blue Book app does not have page numbers, but you can still find identifying a client. So we're going to talk about how to identify a client according to the Joint Commission. And let's get right into the questions. And it's not a particularly difficult topic. You just have to know it. Remember, the Blue Book is all about what you know. It's not necessarily about testing strategies. So since it's not that many questions about identifying a patient, I added 2 bonus questions at the end about diabetes. In case you're want to do some practice diabetes questions, we can do those together. All right, question number 1. A nurse is preparing to administer a medication to a client. According to the Joint Commission guidelines, which 2 identifiers should the nurse use to verify the client's identity? Room number and date of birth. Sorry for the typo. Client's photograph and room number. Client's name and photograph. Client's diagnosis and medical record number. All right, so room number is not an appropriate identifier. Date of birth is, but if the entire answer isn't correct, then the answer is not correct. Client's photograph is acceptable and room number is not acceptable. By the way, the client's photograph is acceptable if it's used throughout the institution. So it is acceptable if the hospital identifies it as an appropriate way to identify the patient. Client's name, that's an appropriate identifier, and photograph, that's appropriate identifier. Client's diagnosis, that is not an appropriate identifier, and medical record number, that is an appropriate identifier. So the correct answer is their name and photograph. All right. So if it says, if there's 2 things in the answer, they both have to be right in order for the answer to be right. Question 2, a nurse is about to perform a procedure on a client. The nurse verifies the client's identity using the client's name and date of birth. What should the nurse do next according to the Joint Commission guidelines? Ask the client to confirm their room number, check the client's identification band, verify the client's medical record number, or confirm the client's address. So you already have 2 forms of identification. According to the Joint Commission, you use the armband to confirm what the patient said. So if they tell you their name and date of birth is one thing and their armband says something different, you better investigate that, okay? Unless the patient is confused, you are going to believe what the patient says. If they tell you their name and date of birth is this, you're going to believe it. If they've got the wrong armband on, you better take care of that before you start doing the procedure. According to the Joint Commission, which of the following are acceptable forms of patient identification? Select all that apply. Armband, medical record number, personal phone number, personal address, last 4 of social security number, date of birth, room number, family member identifies them, or their name. So according to the Joint Commission, name and date of birth are absolutely acceptable forms of identification. They tell you their name and date of birth. An assigned number by the hospital. The hospital can assign them a number, and most hospitals assign a medical record number. It's a very long number, but most hospitals assign a medical record number. So that is also an acceptable form of identification. So name, date of birth, an assigned hospital number, and then a number that is personal to the patient. So you can use the last 4 of their social security number because that's unique to them. You could use their personal phone number because that's unique to them. You could use their personal address because that's unique to them. So the correct answers here are the following. Did you know the Joint Commission doesn't even require the patients wear armbands? Did you know that? They are not required to wear armbands. We do put armbands on people. I suppose it's so that we can scan them. I'm not sure, but Joint Commission does not require armbands. It is acceptable for the patient to tell you who they are according to 2 identifiers. You do not have to look at their armband unless you have a concern about the patient really being who they are. The room number is, you might say the room number is unique to the patient, but The room number can be assigned to multiple patients. They could have a roommate. The room has been assigned to somebody else in the past. The medical record numbers are never repeated. That's why they're so long. And you are allowed to assume that the phone number is unique to them or their address is unique to them. The only time another person can identify a patient is if they are their legal power of attorney or their healthcare power of attorney. Otherwise, we cannot take a family member's word on it. These are all the patient identifier questions I have because it's just sort of that simple, but you do have to know it. Okay, so you do have to know it. And I would say on the NCLEX, you're primarily going to see name, date of birth questions. If they say, what is the first thing that you do before you do anything, identifying the patient, and if identifying the patient is there, then you want to pick that. If identifying the patient is not there, then obviously that's not the answer they're looking for. But if it's there, you want to choose that as the answer. So I've got 3 diabetes questions for you just to practice. And if you're interested in that, we'll keep going with that. During a follow-up visit, a client with type 2 diabetes reports episodes of dizziness and sweating. The nurse notes the client is on a sulfonylurea. What is the most appropriate action for the nurse to take? Advise the client to increase their carbohydrate intake. Instruct the client to skip the next dose of the medication. Check the client's blood glucose level. Recommend the client reduce their exercise routine. So although dizziness and sweating sounds like hypoglycemia, I don't know that it is for sure until I assess it. Now, some people have said to me, you always assess first. You always assess. I'm talking about NCLEX questions. I'm not talking about in real life. In real life, yes, of course, you always assess first. On the NCLEX, it is not a rule that you always assess first, because if you have enough data in the question, you don't have to do any further assessment. You can now intervene. So it depends on how much assessment you have in the question. And all we have is dizziness and sweating. We don't know for sure. It sounds like it, but we don't know for sure that that's hypoglycemia. So we need to get their blood sugar. Will that mean are we going to then increase their carbohydrate intake? We might if the blood sugar is actually low. Will we skip the next dose of the medication? Absolutely not. We're not going to do that. That's a bad option. D, is that a good option to reduce their exercise routine? No, that's not a good option. So B and D are not good options at all. I would never pick those. So it's either going to be A or C. And out of those 2 things, checking their blood glucose is the appropriate action. 5, a nurse is providing education to a newly diagnosed client with type 2 diabetes. Which statement by the client indicates an understanding of the initial treatment approach for type 2 diabetes? A, I will need to take insulin injections immediately. B, I should begin an exercise regimen and modify my diet. C, I will need to take metformin daily. D, I should cut out 50% of the carbohydrates in my diet. All right, type 2 diabetes, the underlying problem with type 2 diabetes is insulin resistance. They do have insulin. Their pancreas is making insulin, but their problem is insulin resistance. So we don't start treatment by giving insulin. So we're going to cross off A. And we don't tell them to cut 50% of the carbohydrates out unless we know they're taking 50% more than they should be, right? So if we don't know enough to tell them to cut 50% of their carbohydrates out. So I'm going to cross off A and D. So would it be better to say you need to exercise and change your diet, or you're going to have to start to take an oral medication? So what I want you to understand is that the ideal way to treat type 2 diabetes is diet and exercise. I know the patients we see in the hospital are all taking an oral hypoglycemic. Like, I know that they are. But that's because these are patients who diet and exercise didn't work for. They were recommended to diet and exercise initially, and that didn't work, or they weren't compliant, or whatever reason. And they had to start on a medication. However, diet and exercise is the ideal way to treat type 2 diabetes. So don't choose medication if you have the option to choose diet and exercise. 6, a client with type 2 diabetes is prescribed metformin. Which of the following instructions should the nurse include when teaching the client about this medication? All right, metformin, that's an oral hypoglycemic. Take this medication on an empty stomach. You may experience weight gain as a side effect. This medication may cause hypoglycemia if you skip meals. Monitor your blood glucose levels regularly while taking this medication. So I don't know that it should be taken on an empty stomach. And I would say most meds are taken with food. Most meds are. There are not very many meds that are taken on an empty stomach. And since I don't know for sure that it's supposed to be taken on an empty stomach, I don't want to guess that it should be taken on an empty stomach when most meds are not taken on an empty stomach. So I'm going to tentatively cross off A. I'm teaching. Oh, follow instructions should the nurse include when teaching. Okay, so I'm looking for true statements. So I'm not gonna pick A yet. Okay, I'm going to cross it off tentatively. You may experience weight gain as a side effect. That one I'm going to cross off with more confidence. Generally speaking, when people start to take medications for diabetes, they actually lose weight because they start to take up and digest and metabolize more carbohydrates. So they don't normally gain weight with oral hypoglycemics. So I'm crossing B off with more confidence. This medication may cause hypoglycemia if you skip meals. Well, let's say I don't know what metformin is for. I'll tell you what metformin does after we're done with this. But let's say I don't know what it's for. So I go, gosh, could it cause hypoglycemia if I skip meals? Maybe. So let's put a question mark next to C. D, monitor your blood glucose levels regularly while taking this medication. All right. That I know is a good recommendation. If they're taking a new oral hypoglycemic, we need to know what it's doing to their blood sugar. We want them to measure their blood sugar regularly. It doesn't have to be 4 times a day, y'all. That's not what it says. It doesn't say 4 times a day. It says regularly, which may be once a day, it may be twice a day, but they do need to check their blood glucose regularly so we know how this medication is going to affect it. So I may say, I don't know if it'll cause hypoglycemia, but I do know they should monitor their glucose levels regularly. So I'm going to pick the answer I know is a good option rather than one I'm not sure about. Now, A, B, and C are all false. Metformin actually should be taken on with food or milk, and that is because it can cause nausea. Like a lot of medications, a side effect is nausea, right? So you take it with food to avoid that. Weight gain, it's just like any oral hypoglycemic. It doesn't cause weight gain. And then it can cause hypoglycemia if you skip meals. It doesn't cause hypoglycemia. It's a remote possibility, but it is very unlikely. What it does is it reduces the release of, I don't know, glycogen or glucose or something from the liver. Okay, so the liver is where we store an awful lot of carbohydrate, glucose, glycogen. And it doesn't allow that to be released. And it also increases cellular sensitivity to insulin. And remember, insulin production goes down as blood sugar goes down. So if the blood sugar goes down, there's this negative feedback loop that goes back to the pancreas and says, don't make any more insulin. So even though metformin increases insulin sensitivity at the cellular level, if the blood sugar starts to go down, the body's going to stop making insulin. So there really is very little risk of hypoglycemia associated with metformin. I hope you found that helpful. It was mostly the first 3 questions were all about knowledge. The last 3 questions were really about testing strategies. So I hope that was helpful to you. Good luck on your NCLEX. If you're interested in paying clinic reviews for something, we do small group tutoring. We also have clinic streaming where you can get all of our videos with no commercials. And we have the world-renowned NCLEX review clinic reviews, which is good for RNs and practical nurses. So I hope you have a great rest of your day. Good luck on your NCLEX.